Lawyers Alert, in partnership with Stop TB Partnership, under the Challenge Facility for Civil Society, is carrying out an intervention implementing the Nigerian TB legal assessment to mobilize and promote the use of the law and courts among lawyers and people affected by TB. With over 500 lawyers across 36 states in Nigeria providing free legal services to our target groups, we have been able to expand and enhance not just access to justice for them, but also the realization of their rights irrespective of gender in TB. Stigmatization, discrimination, and lack of funding in TB are some of the challenges affecting PATBs in Nigeria.
Our parliamentarians, the National Assembly, including the executive, need to channel more resources into TB work. We need to resource TB work. It's about allocations, it's about implementations, it's about release of funding and all of that. We have, for example, the Human Rights Action Plan that has been put together by stakeholders. This action plan needs budgeting, it needs resources for implementation. This is very key if we're going to talk about gender and human rights-based approach.
We understand that TB is not a death sentence. There's less stigma. Number two, when people take TB treatment, almost immediately, very quickly, in a matter of days or weeks, they're no longer contagious. So the more that people understand about the disease, about treatment, and about the experiences of people who have TB, the more that the average person understands those things, the less stigma, the less discrimination there will be.
Gender and human rights approach to TB in Nigeria is germane at this point, especially having regard to the continuous issues of stigmatization and discrimination of persons affected by TB in Nigeria. Lawyers Alert is advancing gender and human rights approach to TB in Nigeria through the use of law and the courtroom. Stigmatization and discrimination is a human rights violation. The judges have this to say.
The Constitution as it is, even though has not specifically recognized rights to health as a fundamental right, but I believe the judiciary can proactively expand the Constitution and interpret the Constitution in such a way to include rights to freedom from discrimination on grounds of health as part of our fundamental rights in this country.
The Nigerian TB program's Human Rights and Gender Action Plan for TB confirms the challenge, and with collaboration with relevant stakeholders, including the National Tuberculosis and Leprosy Control Program, Lawyers Alert is spearheading the move for a gender and human rights approach to TB and for the enactment of a TB-specific legislation. Lawyers Alert has trained lawyers, media, and the TB communities on the ways to leverage on the law and courts to address human rights issues. Lawyers Alert facilitated sessions that ensured multi-sectoral accountability and access to justice for human rights abusers. We are advancing collaboration, coordination building, and TB community media lawyers coalition to advance rights of PATB. We have also developed a comprehensive map of legal services available to PATBs, including identifying small and emerging PATB grassroots organizations and leaders emerging from these groups. Linking these groups into a coalition through its effectiveness, changing the narrative of PATBs and other stakeholders, not just connected and scattered with no opportunity for synergy or coordinated actions. More importantly, PATBs are now availed of free legal services ranging from advice, counseling, mediation, and representation in courts and through strategic impact litigation. TB is not a death sentence, and on issues, Lawyers Alert is rendering free legal services to those who require legal assistance as a result of the breach of their rights owing to TB.